Welcome to the Erie Wellness Podcast, your go-to source for all things health, wellness, and living your best life right here in Erie. I'm your host, Lauren Brunetti, and I'm so excited to have you here. Each episode will dive into conversations with local experts and wellness professionals who are making an impact in the world of health and well-being. Before we jump in, be sure to like, share, and comment on this episode. We love hearing from you and seeing our community grow. Now let's get started. Okay, I would like to welcome Stephanie Traver to the Erie Wellness Podcast. Stephanie received her undergraduate degree from Loma Linda University, located in Loma Linda, California, where she graduated with honors from the International Honor Society of Nurses. She received her Master of Science from the University of Colorado Anschutz Medical Campus, located in Aurora, and is a board-certified women's healthcare nurse practitioner. Stephanie recently opened Vital Menopause in downtown Erie and has been working with women to improve their overall health and well-being with a focus in hormone therapy and lifestyle support. Welcome, Stephanie.
Thank you. I'm very happy to be here today.
I'm so excited to have you on the podcast today. I feel like I have a lot of questions for you. But first off, what brought you into this line of work?
I have always felt really passionate about general health and women's health in particular. And my journey kind of took a little bit of a windy path. I first was thinking I was going to be doing naturopathic medicine, started in a pre-med path and almost finished that, started applying for medical programs, and then looked at the nurse practitioner role and said, nurses do a great job of seeing the whole person, treating the whole person, and they also have this trusted role in the traditional healthcare practice, where people come to them already feeling like, hey, I think you know a thing or two, I can trust you. And there's this balance, this life, work-life balance that kind of comes with that. And I could get there with just investing a little bit less time and money to kind of get started. So that's kind of how I got started. I was a labor and delivery nurse for about 8 years. I've been a nurse practitioner focusing on women's health for 15 years. And I got to menopause because I essentially just aged with my patient population. And as we were all sort of experiencing these same things, saying like, wow, it's kind of hard to get sleep, and it's a little bit harder to have energy to work out. And I'm noticing, the weight's coming on the belly a little bit more. And, we just were having these conversations during their well visits and things like that more and more often. It's kind of like, I really want to be able to help, and I want to be able to help better than I currently am. I feel like I'm ill prepared to do that. So I got a bunch more education, got certified as a menopause specialist, and then started looking at where are all the barriers to care for this type of care. Insurance doesn't like to cover it. We don't really have enough time to talk about it. It's not really something that people bring up as often as they should during their regular visits. So I just kind of started breaking down all those barriers, and then eventually started my own practice, just solely focusing on that to make it as simple and effective as possible.
I love that. So you went to grad school here in Colorado. What brought you to Erie specifically?
I've lived in Colorado my whole life, and I was born and raised in Boulder, and Erie was just, honestly, it was like, Erie is close to Boulder, close to Denver. It's kind of central. It has this beautiful Front Range view. And at the time, about 15 years ago, it was very affordable also. So that was kind of what made me land in Erie. And I did not expect to still be here, but Erie has just blossomed into such an amazing place to live and raise a family and start a business. So I'm really happy that I'm here.
So what have you noticed recently over the last several years of working with women? What are some common health challenges when women face during midlife, and how can we address them proactively?
The most common things I hear are, I just don't feel like myself anymore. I feel like my spark is gone. I feel like the woman that I have known for all these years just isn't here. And I think that can look like the brain fog is set in. So can't remember things like important things and just mundane things. Like what's that word, or what did I come in this room for? Or mood, I want to have space to tolerate this, thing that life has brought me, whether it's in my career or in my family life. And I don't have it, whereas I had it before, or I'm trying to organize my day and it's feeling overwhelming. I want energy to be able to do all these things that are really important to me, and I just can't find the energy. Those are the main things. Weight gain comes there too, but I think a lot of people are like, I want to be healthy. I want to be here for a lot of years, and I want those years to be good years. And I'm working really hard at that, and I'm not getting anywhere. So those are the big things that I hear over and over again. It's really not as often the hot flashes and those things that you kind of hear, you think of when you think of menopause.
Mhm.
It really is the mood, the mental clarity, and the health and longevity.
Physiologically, what is happening to a woman during this midlife phase to their hormones in particular?
So there's a steady and slow decline of some hormones. So that's things like testosterone and progesterone. And yes, women have testosterone. In fact, during our reproductive years, women's ovaries produce more testosterone than estrogen. Um, and then as our bodies notice that we're not having as many eggs and as much quality of eggs, then the body's trying to find homeostasis with the estrogen. So it's not a steady decline of estrogen, but it's a, you know, kind of roller coaster ride of estrogen. And the body is just trying to say, like, okay, we want to keep you ovulating, we want to keep you reproductive for as long as possible. How do we do that? And it tries on this recipe and it's like, oh, that didn't work so well. Let's try something else. And so it can feel like you're a little bit in this zone of chaos where things are rearranging, things are unpredictable, they're changing rapidly. And that's what's happening internally. It's not just necessarily the drop in the hormone, but it's this unpredictable up and down of the hormones. And then every tissue in our body, from our brains to our skin, to our hair, our digestive tract, every tissue has hormone receptors in it. So those hormone receptors in those tissues, those end tissues are responding to those changes, trying to keep us whole, trying to keep us functioning. And some of those things, can feel very profound, and sometimes they feel just a little annoying.
What are the main hormones that you're looking at when you look at a woman's labs?
So we look at testosterone. Sometimes we look at estrogen and progesterone, depending on the age of the person, if they're cycling, and we can find a predictable spot to check that. We also look at things like thyroid. The thyroid is not a sex hormone, but it is one of the hormones that gets impacted in midlife, and it can absolutely affect your energy level, how you lose and gain weight, what your hair and your skin texture is doing. So that's an important thing to check in on as well.
What are the early signs of perimenopause, and how can women differentiate it from normal aging or stress?
One of the earliest signs is that your cycles are going to be changing. Um, it can be they get closer together. It can be they become less predictable. They can become heavier. Um, some type of cycle change. Now, if you don't have a cycle because you've had a hysterectomy, because you have an IUD, because you're on um, birth control pills that are altering your cycle, then that may not be your first sign. In those cases, you want to look to those other things we talked about, like has your mood significantly shifted without some sort of reason why? Is your energy changing? Is your sleep disrupted? Again, there can be other reasons why, but if you start adding these things up, um, and it doesn't make sense, That can be why. Other things can be joint pain that's new, body aches, itchy skin, dry eyes. Sometimes you can have, loss of libido. That's another big one. Change in sexual function. That can look like a lot of different things. So if you feel like you're cruising along and something has suddenly changed and there's not another explanation for it, and you're between the ages of 35 and 55, definitely want to explore if perimenopause is a possibility.
You mentioned brain fog in one of that list. When women report brain fog, can you explain why this happens and what can help?
Yeah, so brain fog is something that we are still trying to understand a little bit why it happens, but they've done studies where they've looked at, PET scans, imaging of women's brains, both before and after menopause and during perimenopause. And the brain is physiologically changing as a response to hormone shifts, changing in energy levels and it's changing in shape and size. And so that has an impact. The other things are if you're not sleeping consistently, if you are losing sleep, if anyone who's had a baby and hasn't slept for a week in a row, that has an impact on your mental clarity, your ability for your brain to function. Another big thing is that when you lose estrogen is anti-inflammatory in nature. And so when you're losing estrogen or you're having estrogen rise and fall repeatedly, it's a systemic inflammatory response. And that inflammatory response creates this mental fog because your brain thinks that you are in a stress response, like you're running from a bear or something, and it prioritizes other function, just your survival function. And so that's one of the things that contributes to brain fog. So some things that can help lifestyle wise, really good sleep hygiene can help. Getting regular exercise to regulate your nervous system. Deep breathing exercises can help. And then hormone therapy can be life-changing for a lot of people. Those are some things. There's also some supplements that can be really helpful for mental clarity. So those are good things to talk to a specialist, a hormone therapist, a hormone menopause specialist about, or to even talk to your primary care doctor about, because you want to make sure that it's not a blood sugar issue, that you're not experiencing some issues with your oxygenation, anything that could be more serious.
Those are all really great points. One thing you brought up was hormone therapy. Can you share how does a woman qualify for hormone therapy and what makes them a good fit for it? When you do say that yes, this would be a good option for you.
Yeah. There are very few women who do not are absolute no's for hormone therapy. And you need to talk to a medical provider to know what's true for you. The main things are going to be what's currently going on in your medical history. A lot of people talk about, oh, well, my mom had this, or my aunt had this, or some family member. That is not your medical history. So it's important to bring your medical history as far as are you healthy? Do you have good cardiac health? That's the most important thing. There's some options that are not going to be as good for people that are not in good cardiac condition. The other really important thing is timing. Are you within 10 years of your last menstrual period or not? If you're within 10 years of your last menstrual period, then benefits are going to outweigh risks for most people, unless you have active breast cancer that is a hormone receptor positive type of cancer. In those cases, you need to talk about other options that would be safe for you. But otherwise, for most women that are within 10 years of their last menstrual period and are in good cardiac health, the benefits are going to outweigh the risks.
What are the different types of hormone therapy?
There's a lot of different types. I would say you hear things like bioidentical and synthetic. You hear things like transdermal and oral. I think the big thing to know is that most of the kinds of hormone therapy we use now are going to be body identical or bioidentical, and that means it matches the type of chemical structure that your body makes naturally. Um, there are some that are not the same chemical structure, and they can still be a good fit for you. Just because they're different doesn't make them bad. um, but those can still be good options sometimes. And then the other big differences are how we give them. So routes, like, there's pills, there's patches, there's creams, there's gels, and there's pellets. And there are some injectables. And I would say any provider who's offering you only injectables or pellets, I would be wary of that, because those are the most high risk forms of getting your hormone replacement. They can be good options, but they should be offering you a wide variety and talking about risks and benefits of each type, because some are much safer. Some have a lot more evidence around them than others. So that's kind of a green flag, red flag to be looking for when you're talking to a provider.
So, what are some long term benefits of hormone therapy, especially with women who are worried about their longevity, improving things like osteoporosis as well as other health ailments?
Um, the really cool thing has been that hormone therapy has been around for a long time and it's really well studied. And what we've learned is that in addition to just easing symptoms and making you feel better while you're kind of transitioning through, it can also have a lot of long-term benefits. And one of those is that it can reverse osteopenia, which is kind of a precursor to osteoporosis. It can also prevent osteoporosis, which is loss of bone density, making it easier to break bone when you age. It can also help prevent Alzheimer's. And we're seeing that it can maybe prevent other types of dementia as well. That study is still, underway. We're still learning a lot about that, how it might work and in what ways it might work, but there's pretty strong evidence there. We're also seeing a lot of cardiovascular health benefits. So it keeps the vasculature elastic and smooth, and that helps prevent things like heart attacks and strokes, which is the number one killer of women above all cancers. So that's a pretty big deal.
That is so amazing. I'm so glad that things like this exist to extend our lifespan and just improving our overall quality of life through the whole duration of it.
Yeah.
So we were talking a lot about perimenopause, but I wanted to talk a little bit about how can women support their bodies and hormones after childbirth, especially during that postpartum period.
Yeah. And there's a lot of women where, they're having kids later in life and, postpartum and perimenopause are even colliding into each other. But, some of the same changes are going to be happening. You're going from a super high hormone state, and then that's dropping, and the body is going through hormone withdrawal. And so, some of the big things are if you're experiencing hair loss, a lot of people experience hair loss during that shift, and sometimes it can be helpful just to know that's normal. It's from having all of these hormones and then it goes away, and it doesn't mean you're going bald. It doesn't mean that's going to continue like that. So sometimes just being able to have that conversation, knowing to expect it, knowing when it's going to stop, like that can be really helpful. Having really connected community to say like, hey, this is really hard. And I'm feeling like someone's needing me constantly. I have no space for myself. This big hormone shift is happening and I was not expecting this. That can be really helpful. There's really specific medications now that are targeting the hormones actually to help for like postpartum depression, postpartum anxiety, even postpartum psychosis. So just being able to have like really honest and frequent conversations about checking in with yourself, checking in with your people, how are you feeling? How are you doing? Are you, it's okay not to be okay. This is a really challenging time in life, like puberty, pregnancy, and um, perimenopause. These are the big shifts. These are really hard times. We personally, we each have never done this before until you have, and each one can feel different. So, just being really honest about what's going on for you. And then if you are having like some vaginal dryness, or some pain, um, some local vaginal estrogen can be huge for that, to give you back a little bit of that hormone that's lacking during that time. Some of the same symptoms can occur. And sometimes we will even give the same hormones that we give in perimenopause, postpartum, depending on if you are breastfeeding, depending on if you are needing contraception, what the needs are there. So I think just, being really honest about what your needs are, having some conversations, and having a provider that you feel really comfortable talking to those things about.
As a mother of three who had all three of my pregnancies within 5 years, I can totally relate to what you're saying, and that it's not until you get out of that period where you're like, I really was in some sort of survival mode, and things become so much easier, of course, as the children age. But having that support system is really crucial to, just not only just surviving, but being able to thrive during that season and being able to enjoy your babies while they're little.
Mhm. Yeah, and it's I think there's a lot of guilt and shame that's around, like, oh, if I say this is hard, if I say I'm struggling, maybe it takes away some of the like joy of the moment also, like maybe I'm not feeling gratitude. I think you can have both in the same space. Like you can be grateful, you can be present, you can be soaking it up, you can be enjoying your babies and struggling all at the same time.
How long does it take for a woman's hormones to stabilize postpartum?
That can take up to 2 years. After the 2 years, we kind of consider it to not be postpartum related. um, but it's pretty common for it to take that long. Some women, it can be faster, depending on just your body or your genetics, if you're breastfeeding, how often you're breastfeeding, all of those things. But I would say it takes longer than people think, and especially if you are in that cycle of having babies back to back, then can kind of be in a roller coaster.
What are some signs that help is needed?
I would say, if you feel like I can't feel motivated to do the next thing, like I know I need a shower, but I just cannot get myself to get up and get the shower. That can be a sign. If you feel like it would really, really feel good for me to have, someone support me in this way, but I cannot even think about asking for that. Um, if you feel like the times where you're feeling like a heaviness or a panic more often than not. Those are really clear signs. Of course, if there's ever any thought of, I've been thinking about harming myself, I've been thinking about harming someone else, even if the thought is coming and going, it's so much better just to say, hey, this thought has come up and that scared me. Than to be holding that, because just the weight of holding it and not sharing it is heavy. And unfortunately, I've been in this field long enough to have had sad, hard things happen. And it's so much better to reach out, get the support. Worst case, you have a conversation and they say, wow, I'm here for you if you need anything. And that's the end of it. You feel better, you know?
Mhm. What does an initial consultation appointment with you look like?
So I offer a free discovery call. And so that's how most of the conversations start. It's about 15, 20 minutes. And it's just a Zoom call, or it can even be a regular telephone call. And it's just, hey, this is what's going on for me. they can get to know me, I can get to know them, just a little bit of like, is this a good fit, kind of thing. And then if it feels like a good fit, then they can set up a 1 hour consultation in my office here in Erie. They come in, we talk about what are your goals, what's important to you, what's your medical history, what symptoms are you having. We go through the whole list to make sure that we're connecting all the dots and we're being really complete about it. And then we come up with a game plan and we start it that day. They walk out with something that they can start that evening or that day. Sometimes they'll like walk in the bathroom, put the patch on, and before they leave. And then we usually meet back up in, a couple of weeks, and they can tell me, hey, I'm noticing I'm sleeping better. Hey, I noticed that my energy's back. I like, oh, I'm feeling my spark come back a little bit, and then we can kind of keep building, layering things in, tweaking things till we get it perfect.
What are some of the like preventative health screenings that you do inside of your practice?
So I offer things like thyroid screenings. I check for anemia. I look at blood sugar is really important. And we also talk pretty completely about what nutrition are you currently doing? What kind of movement do you enjoy? How can we maybe add to that or change it to really support your longevity? We look at supplements you're currently taking. I can advise on supplements that are probably just, making expensive pee, and some that might be helpful to, really help you reach your goals. So those are things that we do together. And all of that's included in my membership. I have a membership model. So it's kind of a one-stop shop.
And when you're discussing things with a new patient, you're going through lifestyle too, right? Sleep patterns, like you mentioned, nutrition. What else are you asking them questions about?
And we'll talk about lots of things. When people tell me like I have no libido, we're going to talk about like, do you have space for yourself? What's your relationship with yourself? You know, do you feel like everyone wants a piece of you and that's just one more thing on your to-do list? So, sometimes we'll get into talking about, how's your job going? How's your relationship? Things like that. So, when I talk about whole person care, it's the whole person. And there are things that are absolutely outside my scope. And for those things, I have this awesome network of people that I refer to. But yeah, we talk about sleep hygiene. We talk about hydration. We talk about, nutrition, movement, anything that I think can be helpful. And, I feel like having an hour to have these conversations is really helpful because we can kind of cover all the bases, and people can email me or text me in between if something comes up and they've just got to worry. So no one's staying up at night worrying about things.
I love that because you're not getting this type of care normally during one of your annual exams with so many different practices. So I love that you care about your patients and you're wanting to really investigate and determine what is really going on in their lives and how you can improve things, not only with lifestyle and then hormone therapy, but other things as well.
Yeah, it's really a privilege to be able to do this. And, I wanted to do this in my other practice, and, there's just not enough time. You know, you have a lot of people you need to see in a certain amount of time. So it's great to be able to do this, and I'm happy to have been given the opportunity.
What wellness trends are you currently excited about, and how do you see them shaping the future of holistic health?
Surprisingly, I am really excited about the GLP-1. So that's like the semaglutide and the tirzepatide. Um, it has been one of those things that I've just been kind of sitting back and watching for a little while, and I've started utilizing them in my clinic more. And what I've seen is not just weight loss, but also decreased inflammation, decreased food noise, people being able to overcome these kind of addictive qualities to things, but also I've seen that as long as we layer things in and we have a solid foundation of good nutrition, people are committed to their frequent movement and they're getting in their resistance training and they've got their hormones balanced appropriately, they're getting really good results and they're also having better longevity, long-term results, things like that, which I was not expecting. So that's been kind of a cool thing just to observe. And I'm excited to see what happens, even longer as we continue being able to see these things down the road.
If you are someone who's interested in GLP-1s, what's some questions that you should ask yourself or talk to your practitioner about?
Really important things are be honest with yourself. Are you able to commit to getting your protein in? Are you able to commit to resistance training 3 times a week? How long have you been struggling with your weight? And the question of how long have you been struggling with your weight will tell you how long should you expect to be on these medications. If you've been struggling with your weight for your lifetime, you probably will be on these medications for a much longer time, maybe not a lifetime, but for a long time. If the weight concern is new because of something like perimenopause, or you've just had a baby or something, a surgery, then the solution is probably going to be more short term as well. But I think, those are the things that I have pretty big conversations with. And when you're talking about how you get these, where you get them from, if someone is willing to ask you 0 questions, give you 0 support, and just give you a prescription and walk away, I would ask some questions about, is that a safe place to be getting those medications? Because they're great medications. They're a very powerful tool, but they should come with, are you the right person to be giving this to? And how do you do this successfully for sustainability and for longevity and for health? Not just give me my money, I'll give you your medication and let's go on our way. I think that's important.
Stephanie, I love your perspective on holistic health as well as saying that it's a tool, right? Because we have to have so many other things in place before we can just start adding other things in as well. And, nothing is going to be a magic thing in your life that,
Yeah.
there's other things that need to happen as well.
Yeah, 100%. Yep.
Alrighty. Well, as we kind of wrap up our conversation today, what are some simple and actionable steps listeners can take today to better support their new overall well-being?
I would say, pay attention, keep a little journal, keep a little notes on if you're having changes, if you're having new symptoms, just kind of keep track of it because it's easy for it to get lost in the noise and it's easy to put yourself at the bottom of the list when you've got a long list. Um, if you are looking for one thing in nutrition, just try to eat 30 grams of protein 3 times a day. And put a little bit of intention on yourself. If it's, 5 minutes of deep breathing, if it's, go outside and get some sunshine on you, just take a little moment to say, hey, you know what? You're also important. You've got lots of other people and lots of other things that want some part of you because you're really awesome and you bring a lot to the table, but also you deserve some of that. Just give a little bit to yourself because you deserve it.
What are some other things that you have going on, workshops, things like that within your practice downtown?
Yeah, we oftentimes will do a couple of times a month. We'll do a screening of the M Factor, which is a really great documentary on menopause. If you haven't seen it, I highly recommend it. So I don't have one scheduled right now, unfortunately, because I'm going to do some continuing education this month when I normally would be doing it. But I will definitely. I post it on my Instagram. I post it on an email to all of my members and anyone who's on my email list. So that's a really great opportunity. We also do open houses. I'm here at the Erie Wellness Collective. We've got other providers here. And that's a great option just to come in, meet me. I do little mini consults. And you can also meet with the therapists that are here, the estheticians. We have a new massage therapist. So it's a great opportunity just to get connected here in Erie.
Mm-hmm. Do you have any good resources for women who are currently or about ready to transition to that menopause period?
Yeah, I would say, if you're looking for a provider to kind of support you in menopause or, in perimenopause, the Menopause Society has a list of certified providers. They also have a bunch of providers on there, but you want to look for the ones that are certified. They've just taken the extra time to learn about how to take care of you appropriately.
Mm-hmm.
Heather Hirsch has a directory online of providers that have taken extra courses, and Dr. Mary Claire Haver has a source online called the Pause Life, and it's got recipes and providers and a bunch of things that can be really helpful, just easy things.
Thank you, Stephanie, for being on the Erie Wellness Podcast. We appreciate you sharing your insights with us. You really provided so many important things for women to consider and think about as they're kind of in these different stages of their life. Thank you for that holistic perspective and just making sure that we have all of these foundational pieces in place to be thriving regardless of where we're at. And as a reminder, Stephanie can be found at the Vital Menopause in downtown Erie, and she is an excellent source for overall health and well-being with a focus in hormone therapy and lifestyle support. Thank you, Stephanie, for being on the podcast.
Thank you. Appreciate it.
That's a wrap for today's episode. Thank you so much for listening to the Erie Wellness Podcast. I truly appreciate you being a part of this journey. If you loved today's conversation, don't forget to subscribe, leave a review, and share it with a friend. For more daily wellness inspiration and behind-the-scenes content, be sure to follow me on Instagram at the Erie Wellness Podcast. I can't wait to connect with you again soon.